Thank you for joining us today. My name is Stacey Haywood, and I'm the Sales Director for NASCO Healthcare in Canada. Leading the session today is Angela Honig, registered nurse and our fabulous clinical simulation specialist. We are very excited to introduce you to our newest patient simulator, TERi. Before we get started, I would like you to know that this session is being recorded and will be available to view on YouTube should you wish to review it later or share it. We do not have the ability to assist with any technical issues you might be having with Zoom. And if you have any questions, please type them into the public chat. We will pause your question periods throughout the session. Take it away, Angie.
Thank you, Stacey. I would like to welcome everyone to our virtual presentation of TERi, the androgynous geriatric patient simulator. Since her release in June of 2020, TERi has received overwhelming interest. This amazing simulator has been purchased and welcomed into many institutions to meet the needs of age-appropriate training. TERi is currently being utilized in university simulation centers, community colleges, emergency medical training, high schools, geriatric patient care facilities, and hospitals. Providing care to the geriatric population has added the importance of understanding the needs of a patient with multiple diagnoses and increased risk of exposure to COVID-19. The evolution of TERi is from our geriatric patient, which is one of our top-selling mannequins, and TERi as well is following in those footsteps to be one of our top-selling mannequins as well. We are so excited about the realism that TERi has to offer, the ability that all the different things that you can do to her. We're very excited. I'd like to start from head to toe and kind of explain all the things that TERi's capable of doing for all of you. First, I'd like to talk about the geriatric care just from the acts of daily living. If you'll think about washing someone's hair, let's get TERi's mask off so we can see her a little better. If you think of washing someone's hair, ear care, changing out her pupils, or even doing medications, as you can see, the pupils can be removed and easily changed out. And just you place them back in this way. The skin on her face is very realistic, giving you the jowls and stuff that you would need, identifying a geriatric patient from afar. You're also able to do dental care on her by removing either brushing teeth that are in there or removing her dentures to be able to also care for them. When it comes to her ears, you'll notice that we have hearing aids as well, that you can put the hearing aid in her ear. I should turn that the right direction. Since her earlobes are the way they are, it nicely fits behind her ear. You also have the ability to be able to, with this mannequin, unlike any other, utilize a nasal cannula. And placing the nasal cannula on her, as you'll notice, you can secure them right behind her earlobes so that you can get an appropriate fit without having to worry if it falls off and adjusting. And then possibly checking those areas for skin breakdown. So you'll notice as we move down TERi a little further, on her skin, once again, the appropriate aging of the skin as well. TERi comes with both a blood pressure arm. So let me grab her blood pressure. The blood pressure arm comes with the box. You're easily able to program and adjust and take her blood pressure by listening for the Kirchhoff sounds and also doing a radial pulse on here. When we come back to the neck on her, she does have a carotid pulse as well, just for when you're performing CPR. And then we have her IV arm. I'd like to take a moment to also let you recognize the amazing range of motion that TERi is able to have, moving her limbs up and down. So when you're assisting with range of motion with your patients, for baths, any of those things, she's capable of doing those things as well. Do you have any questions at this time?
I don't have any questions in the question chat at this time, Angela. Should we give it a couple of seconds? If anybody has a question, please go ahead and type it into the chat now. You can also do so during the meeting, and I will stop to read them when she takes her pauses.
Thank you, Stacy. Some of the features I really like about TERi is, though she we have her set up as a female right now, she also may be a male. The breasts and stuff are androgynous to both sexes, as well as if we see TERi without her wig, it's easily taken off. Her skin is made of a silicone. On her skin as well, you'll notice there are some marks, whether it be decubiti, coloring. There are some skin cancer things from different stages that you can find across her back. Her hands and fingers are very posable. So if you'd like to possibly do a rag roll in the hand for someone with contractures, it's very easily done with TERi, especially with how easy they move. Some of my favorite features on her. Before I carry on, let me check with Stacy again to make sure there weren't any questions.
Angela, there's still no questions. You're doing a great job.
Thank you. I'll move on next. The next part about TERi I'd like to talk about is applying the oxygen. We talked about the nasal cannula, but she also has the ability to have a trach. So if you were going to do ventilator care or to have her on a ventilator for training, you can also have a trach there for trach care, changing of ties, cleaning that, possibly utilizing our patient monitoring system to show possibly some mucus plugs. All of that is capable with her. Go down from there. I'd like to talk about our CPR. Our CPR with TERi, we're really excited because not only are you able to do CPR unlike on the Geri line, on our CPR with the biofeedback that's available, you get to have the rate, depth, position of your hands, recoil, ventilations and possibly ventilations, and all of these things are all AHA compliant and meet the Canadian Stroke Association as well. We're very excited for those things. Okay, my next move. I'll go back to the IV really quick. The IV arm, just so you're aware, you do have coming down into the wrist, into the antecubital fossa, and this comes with her as well. Let's go down to her abdomen. When you're talking about feedings, you have the option to an NG tube on TERi, as well as doing a G tube on her. So a nasogastric or a gastric tube directly into the stomach for med administration, flushing, making sure placement is correct. All of those things are capable with her indwelling capture areas. We also have on her, so I can move my thing down a little bit for you guys. Wrong direction, sorry about that. There we go. We come down into the abdomen more, you're also going to be able to notice that TERi has stomas and an ileostomy. The stomas, bag changes, care, making sure that the stomas are cared for correctly if the bags are leaking. And then the ileostomy is for urine if she does not have an indwelling catheter or not capable of doing so. TERi also has male and female genitalia for cathing, for doing male catheterization or female, but on top of those, not limited to that, the female portion of her also allows you to do pap smears. When doing a pap smear with TERi, you have the ability to change out the cervixes. And as you'll notice here, I have one soft cervix that's interchangeable, along with 5 other different processes, disease processes, that also can be interchanged out on the female side. On the male side, not only are you catheterizing, but you're going to also be doing prostate exams. So with the TERi mannequin also comes interchangeable prostates, 1 normal and 4 different prostrates to go along. Here's your normal one. So when they're doing the exam, you're able to get a much more realistic identification of what's going on with the patient. Also with the male, when we're talking about catheterization, because not everyone has a circumcision done, we've also included the foreskins to be able to add to the male model to be able to practice first pulling back for catheterization and also for cleanliness, because those areas are very important to take care of. As we move down the legs a little bit with TERi, I'd like to point out once again the range of motion that you're able to complete. I know some of the challenges with patients, especially the elderly population, is about edema in the feet. TERi comes with 5 different pedal edema pieces that you can interchange out, being able to press down on them to see how long it takes for them to fill back up, being able to meet your 0 to 4 seconds of inflammation. Another area that I find extremely beneficial is when we're coming to, we also have included in what would be a wound skin for decubitus on the feet. This can go on either foot. It comes with 4 different interchangeable wounds that you're able to place on the mannequin. And here they are. Do we have any questions right now?
I have a question
Yeah.
in the chat. How much does TERi weigh?
TERi's weight is approximately 64 to 70 pounds, I believe. When she ships in the box with all of her supplies, obviously she's much heavier than that, but that weight does help once she's assembled and put together for being able to do transfers light enough to be able to maneuver around as a single person in a sim lab, but enough that we would be able to do the peg of the feet when we're trying to lift her up and transfer her to a wheelchair, or to be able to utilize her as doing bed transfers with the Hoyer lift as well.
Fantastic. I'm really excited about this mannequin.
I know, so am I. Let's see, what else do we have?
That's it for the questions right now, so I'm going to let you continue.
Okay. Some other neat things that we've included with TERi are going to be with every one of the mannequins. You'll receive obviously the artificial blood flow. We have some simulated urine that also comes with her as well. And then we have our artificial blood that we usually send with all of our IV arms. For the auscultation, since I didn't cover that yet, the auscultation of TERi, we include one of our auscultation sets with the remote control. So your students can use the stethoscope. Guess I'll sit down so everyone can see me now. You're able to, there we go. How about that? You can put the stethoscope in your ears then, and as an instructor, be able to use the remote control to change out depending upon what sounds you would like to have them hear. We also have lubricants available, bags available for the IV arm, as normal with all of our other mannequins. Any other questions?
We're just answering some of the questions about translating into kilograms on the chat. So if anybody needs that information, you can see in the chat. Also, there is a comparison chart that shows you the different levels of TERi in the chat. The instruction manual and the cell sheets are all in the chat. If anybody's interested in downloading those, please grab them. Outside of that, Angela, we don't have any other specific questions about the mannequin at this moment.
Okay, well then I will cover the last piece with TERi is on the TERi patient simulator. She does come with a patient monitoring option. And that option allows you to have a rolling cart, which I'll roll in here now. That rolling cart allows you to have vital signs, a blood pressure cuff. So though we have the one built in, if you're looking at more of a pneumatic option, how our clinical technicians or patient care staff are able to utilize it, you can utilize this for just maintaining and getting pulse oximetry with a heart rate. If you'd like to have a hospital monitor, inside of this package also includes the choice for ventilation, defibrillation, a pulse ox, a glucometer as well. We're very excited that TERi is able to bring to the market a mannequin that can meet all with 3 different levels, meet the needs of 3 different patient sets of care. 1, our patient care, 2, the skilled care, and 3, the medical care provided by a physician. We're hoping that you find and love TERi as much as we do.
Fantastic. Wow, that's great. So have we done the full head to toe then, Angela? Everything's been covered?
I believe so. I'll go back over it again really quick. So we have her interchangeable wigs that you can change. She has the female wig. The second would be your interchangeable eyeballs, which are easily taken out. And Almost dropped that on the floor, guys. Sorry about that. The eyeballs. There are 3 different sizes of pupils: normal, constricted, and dilated, that you can change in and out on her. You're able to do the nasal and NG, oral intubations as well. I believe I missed that actually. So you can orally intubate her with your standard LMA intubation. I'm going to miss them all because I'm horrible at it. Also a nasal and NPO, OPA. There we go. NPA, OPA. I always forget the letters. Sorry today. Intubation. We have manual pulses on the neck. We have the electronic pulse on the left radial arm. Right arm is going to be your IV arm. Heart and lung sounds to be utilized with the stethoscope and remote control, anterior and posterior. Those are RFDI tags. So placement as they're going, if you have it set when they hit on those, it'll play the appropriate sound. We have feedings that you can do from your gastric tube, gastrostomy tube, or the NG tube. You have your ostomy care for fecal or urinary excrement. You also have the female and male catheterization and exam pieces. The legs, very, very range of motion on arms and legs, shoulders, all very realistic. Going down to the wounds and stuff, you can add to the feet with the edema and everything else. Our CPR that's built in that provides you with PDF printable information that allows you to be able to contain that stuff for your age appropriate training. Ears, you can do eardrops. You can also do the cleaning of the ears. You can do the O2 tubing and also a hearing aid. If there's any questions or any more things that you'd like to know about TERi, please feel free to contact your regional representative, and we'd be more than happy to work with you each.
I have one more question.
Yes.
Can you use regular stethoscope when auscultating different sounds?
Unfortunately, right now, no. It is part of a system that allows you to, it's a remote control, since it is an RFDI tag, it does need the stethoscope that comes with it to identify those.
Fantastic. And one more question. Can monitoring auscultation and blood pressure be synchronized?
They can be synchronized if utilized outside of TERi, if you're utilizing the SimVS. So the patient monitoring suite we have is more of a hybrid. So first off, you can have your heart and lung sounds and stuff independently ran with each piece. And then outside of TERi, if you're looking for more of a patient monitor that you can confine everything to one area, you can get your pulse ox and rhythms and those things and blood pressure through the through the patient monitoring system, but the lung sounds and heart sounds as of right now are through the mannequin, through the stethoscope.
A couple of other questions. Can you monitor the CPR from Massimo? Massimo, I believe we went over the feedback that we got for CPR. So it's AHA compliant. It allows you to have feedback on the depth, rate, hand placement, recoil, and you have the option of ventilations as well. And that information is stored. You can PDF that or save it in Excel, so you can remove that information and keep it on files with your student's name attached to it so that you understand how their CPR is going. And also from Regina, she's asking, you said something about the skin of the back. Can you repeat that, please?
Yes, on TERi's back currently right now, though I can't, I can pick her up and flip her around for you if you'd like, but on her back, let's see if I can lean her over a little. And this top shoulder, I am gonna move her a little bit for you. On this top shoulder, as I bend her over a little, you'll see some skin tags that are available here. So there are, in different areas of her back right now, the ability to be able to have different wounds on her for them to find in during assessment. What I would like to add on about the CPR for a moment, the CPR is an app that's available on the tablet that you can download and be able to see your students on a student side of it so they can watch how they're doing. And as an instructor, you also have an instructor view as well. So it's capable of going both ways to have a visual as you're doing it and an auditory reminder during practice for the students.
And I think that's the end of our questions right now. So what we will do is we will pause and we'll stop the meeting. Angela and I will stay in the room for a few more moments in case there are any further questions, but feel free to leave as we have completed the head to toe of TERi today. Thank you, Angela. You did a great job.
Thank you. And thank you everyone for coming today. It's been my pleasure to introduce TERi to you. She truly is an amazing mannequin that will only increase the training capabilities of your institution.
Awesome. Thank you so much.